wonderful interpreters. I am here at Skagit River Chiropractic. We're here to interview Jason Kitzman. He's a chiropractor here in the area. We want to talk to interpreters in the area, providers, how they feel about LNI's new implementation of a scheduling system, how this change is going to be affecting the quality of care that they are used to receive with independent interpreters. Thank you for tuning in. So come on, let's go. I think this is a great opportunity because neighboring industries, they had their staff meeting with providers, patients, interpreters. But when you come to the field, when you come to the area where people work, where people get their treatment, patients, where providers actually help these injured workers, you understand a little bit more of the nuances of our profession, what we do on a day-to-day basis. Let's get in. So we have now the opportunity to interview Dr. Jason Kitzman. How are you today?
Thank you. Good, really good. I've been an LNI provider for 20 years at this location. We have treated all kinds of LNI patients, Hispanic, Spanish-speaking patients. This area is an agricultural area, non-English-speaking workers. With the interpreters, we know that when a patient comes in for their second visit, we know who the translator is. As they travel with that patient through those appointments and through their treatment in our clinic, they're able to have an innate knowledge of that patient's case and what's happening to them and the trials and tribulations that they may have gone through. It makes our job much, much easier. I have still, to this point, not heard a single word from LNI about the changes in translation.
The system will be implemented anytime this fall. That convenience that you're talking about, having a translator, an interpreter, that's going to kind of disappear when it comes to subsequent therapy sessions, because they want interpreters like myself to only be available for you for walk-in appointments. How is that going to affect you as a provider?
It's going to affect the patient. I don't know how to request an interpreter. That's now going to drop on my staff. The patient's going to show up and not have an interpreter. That patient is probably going to have to reschedule and come back once we secure an interpreter.
If LNI doesn't amend this policy and then you have to procure interpreters through a scheduling system every single time when it comes to coming over here, are they going to be comfortable to still come over here and continue services? What do you think is going to happen?
Not at all. That non-English speaking population tends to not seek care anyway because of the uncomfortableness and the unknown of the situation. Let's make up a hypothetical situation. Somebody's bending over and they pull a groin muscle. That groin muscle happens to have a negative effect on their sexual life. How many times are you going to want to tell somebody that? Your initial translator that you have a relationship with your doctor, and then that doctor refers you to a specialist like me, and you have to say that once again to the specialist. But to have to mention this every single visit to a new interpreter and say, can I have this problem? You have a block of my time. If we're catching up that translator or interpreter, patients suffer for treatment time and the unknown of who their translator is going to be and if they feel comfortable telling their story again and again. Our goal here is to get the worker back to the job of injury at full duty, off of LNI, and back in the workforce.
Any injured workers that do not speak the language, they don't speak English, how many of these patients have you seen show up to your clinic to seek medical care for their injuries without an interpreter?
Yeah, most.
Without an interpreter?
Without an interpreter, they generally will bring a child that goes to public schools that's bilingual.
Would you prefer to have an interpreter then?
Oh, for sure. We need somebody who's trained in medical terminology. I don't want to explain to a translator what I'm trying to say. Again, It's going to affect treatment time.
Have you had any problems with an interpreter or a business trying to coerce you into only using their services for your patients?
Yeah, never. I don't mean to break the light on everybody. LNI is no cash cow. I'm not going to be retiring on LNI checks coming in. Certainly, I have interpreters that I like better, work with better. They're always on time. They're always ahead of schedule. They always call and remind the patient that you have this appointment time. I do have better professional relationships with some than others, but I certainly have never offered kickbacks. I've had, in our clinic, we've had nothing but great experience. We're a small town. We use the same 10 interpreters. Occasionally there's new ones that come in and start in the field. I sure would really like to continue to use those, but more than anything, I'd like that interpreter to be able to follow the patient through their care. Our receptionist has a lot of responsibilities. Our billing girl has a lot of responsibilities. We have enough required documentation and required work to do for LNI as it is. The patient absolutely will suffer if the providers are responsible for getting those interpreters, and providers who may have an issue serving non-English speaking patients.
Yeah.
They're out there,
Exactly.
right? They are not going to pay their staff to sit and hire an interpreter that they shouldn't need anyway, right?
Have you had a problem with an interpreter because they have interfered in the counseling, the decision making when it comes to next steps in a claim?
I've never had an interpreter ever step into the role provider. I've never given a referral and had a translator say, "Ooh, you think you could maybe write that referral for..." Never ever.
Never. What final message would you have for the Department of Labor and Industries to let you work with interpreters that you have trusted and they are experienced for so many years?
I encourage you to get a hold of Washington State Chiropractic Association and let them know that this change is going on. We had no idea. If that new patient shows up at my office and doesn't have a translator, I will not see them. I will not risk my profession and the patient's health to not have a clear picture of what's going on with that work-related injury. We're an extraordinarily Hispanic-friendly clinic. You know, we have lots and hundreds of patients. If I'm saying that we're not going to see that patient, there's probably lots and lots of docs who are going to stop seeing those patients.
Thank you so much for doing this. This is going to end this section of the video, and we'll see you in the next one. Hi again. I hope that you have enjoyed the first of our series of interviews with providers. Look, there's been a lot of misinformation, deception, and slander coming from WFC Local 1671's leadership through the years. We have been painted all to be privileged, territorial, abusive to patients, and unethical. But as I have shown in my videos, these are very few cases, and LNI has successfully dealt with these individuals. Now, the reality is that WFC has manipulated data. They have destroyed our reputation as independent LNI interpreters and agencies before legislators and LNI, all in an effort to change the system to their convenience. Now, we can't let them win. As you may know, we have started the election process. It is time to unite once and for all. WFC Local 1671's leadership, you know what they're doing? They're counting on us being divided. That's what they do. Please see the instructions in the description below to download, print, and to send us your signed card. Subscribe to my channel to get all notifications of my videos. Let's win this thing and take control of our profession. And as always, God bless. See you in the next video.